With millions of dollars being spent on Ohio's Senate race, it will be one of the most watched in November.
There are billionaires who actually could buy the state of Ohio's entire election cycle multiple times over.
How special interest groups, including labor unions and nursing homes, are playing a crucial role in financing campaigns, and why some advocates say it's out of hand. Plus, it's the debate happening across the nation and here in Ohio. What do you value more, privacy or safety?
These cameras are not instilling a sense of safety in our community. They're only surveilling us.
Just because a tool is abused does not mean that the tool is not an effective tool.
Concerns being raised over flock cameras and changing the childhood vaccine schedule again.
I think it's more political than actual what impacts healthcare currently.
President Trump signs an executive order, but doctors say it's a dangerous plan.
Now, from your local election headquarters, this is Sunday Briefing with Colleen Marshall.
Nowhere in America will more money be spent on a U.S. Senate race than right here in Ohio. The Democrat Senate Majority PAC will spend $64 million backing Sherrod Brown. And the Republican Senate Leadership Fund is investing $79 million in the campaign for Jon Husted. Welcome to Sunday Briefing. I'm Colleen Marshall. Each Senate candidate is raising millions more through their personal campaigns. Those donations often come from special interest groups. That is what troubles the leader of an organization known as the Ohio Alliance for Retired Americans, who is especially concerned about the influence of the nursing home industry.
It appears to me, personally, and to a lot of us who are advocates, that the nursing home industry spends its money on legislators, but does not spend its money on improving the quality of care.
Norm Warnett is president of the Ohio Alliance of Retired Americans. It's supported by retiree organizations from the labor movement, and it advocates for community-based care for aging Americans. He says the nursing home industry lobbies against that and makes big dollar donations to politicians.
We now have $100 million campaigns, and it's just a corrupting influence on everything and doesn't meet the needs, the policy needs we need to change in the state of Ohio.
His example is Senator Jon Husted, who years ago as a state lawmaker co-sponsored a bill to shield Ohio nursing homes from liability, even in wrongful death and abuse cases. Since then, Husted has accepted more than $1 million in campaign contributions from the nursing home industry, its executives, and lobbyists.
It is wrong to see that somebody like Senator Husted, when he was in the legislature, would co-sponsor a bill that in fact avoided the liability on the nursing homes. So that's one example of how the politicians get continued support again and again.
We checked Husted's most recent campaign finance report and found more than a dozen nursing home PACs or lobbyists have given at least $34,000 so far this Senate campaign. Husted backed the big, beautiful bill, and Warnett says it favors nursing homes and Medicaid funding over home-based care. But the bill drastically cuts overall Medicaid funding. And in a statement, Husted's staff told us nursing homes did not get an infusion of cash, and the bill made it easier for states to move to home-based and community care. Warnett, ironically, was at one time a labor activist who raised money for his national union to support political campaigns.
It seems to be the only way that workers are able to get a voice in this very difficult time.
We checked the most recent finance reports from the Democrat in the Senate race, Sherrod Brown, and found $220,500 in contributions from 33 labor union PACs. Brown's campaign tells us most of his money comes from more than 80,000 small dollar donors, and says in a statement that while Husted fights for special interests, Brown fights against the rigged system, pointing out that Husted took nearly $700,000 from insurance companies. Ornette says he believes labor must be part of the conversation, and he also believes we would all be better off if campaign seasons were shorter and special interest influence was out of the election process.
People then can make a decision without the terrible influence of money and advertising that often distorts what the real issues are confronting people.
It is important to note between now and 2034, the One Big Beautiful Bill cuts Medicaid more than $900 billion. And while it's true that states can decide whether to allocate Medicaid dollars for home-based or community-based care for the elderly, because those services are optional, experts say they are likely to be cut because of all those funding reductions. You are being watched. Everywhere you go, you are under surveillance. There are hidden cameras in stores, in schools, on light poles, and likely in your workplace. But there is a particular kind of camera that's causing an uproar. It's a license plate reader. Police are using it in incredible ways to solve crimes. But sometimes they are misusing it. And sometimes that data is going to ICE. Now, citizen activists are demanding an end to flock cameras. It was a shock last December when 37-year-old dentist Spencer Tepe and his 39-year-old wife Monique were shot to death in the middle of the night. Police found few clues inside their short North Columbus house, but used license plate readers to place Monique's ex-husband, Michael McKee, in their neighborhood at the time of the murders, and he is now awaiting trial. Detective work made possible by flock cameras.
If you talk to law enforcement officers, detectives, they'll tell you again and again, this is the most effective tool for solving crime and actually a lot of times preventing harm or death that they've seen in their career.
But citizen activists have a different view.
We're asking to dismantle these cameras completely.
A group known as the People's Justice Project is working for a statewide ban.
We found that through these audits that thousands of times that these flock cameras have been used to feed information to ICE and immigration and customs enforcement agencies at large to kidnap our neighbors, kidnap our immigrants off the streets. And we've also seen misuses of police departments, or police officers rather, using these cameras to stalk ex-girlfriends or et cetera, using these cameras for really inappropriate purposes.
An audit of flock cameras in Columbus revealed more than 15,000 searches possibly connected to immigration enforcement. Columbus, Cleveland, Marion, Ironton, and Dayton all considering bans or reduced contracts. In Reynoldsburg, 2 police officers caught using the cameras to keep tab on their exes had to resign.
There can be abuses. When there are abuses, we have to take action. It's the same way with running a record check. Every once in a while, when I was Attorney General, we would see somebody who's in law enforcement who was running a record check for non-good reasons. They were running it because of personal interest, and that's illegal. So just because a tool is abused does not mean that the tool is not an effective tool.
The proper way to deal with this actually is to wrap law around that punishes misuse of the flock cameras. That's what we need to do.
The founder of the Flock Company agrees.
What's new is about 4 months ago, we built an audit assistance tool. We heard loud and clear from communities, from police chiefs. We don't want bad actors in our police departments either.
Police across the state say they rely on Flock for everything from murder investigations to drug deals, kidnappings, even helping to find wandering dementia patients. State lawmakers are considering guardrails. Both of the candidates for Attorney General want the guardrails, but also the flock cameras.
I support the continued use of flock cameras, provided that we do have meaningful public access to be able to monitor what types of searches are being done.
As a civil libertarian, I am somebody who is concerned about Big Brother. But in the end, we want to make sure that law enforcement has the tools to solve crimes.
Coming up, a new executive order aims to change the childhood vaccine schedule. How one state health official is responding to the president's new efforts. President Donald Trump signed a controversial executive order calling for childhood vaccines to be spaced out into separate medical visits and splitting the combined measles, mumps, and rubella vaccine into 3 separate shots. Public health experts are raising concerns that could lead to an increased risk of children becoming infected with vaccine-preventable diseases before they get all those shots. And the news comes as school resumes around the country. The U.S. faces a measles outbreak that could threaten its elimination status. The president repeatedly suggested the number or timing of vaccines could play a role in rising rates of autism. But scientific consensus and decades of studies conclude there is no link between vaccines and autism, and the president did not provide any evidence of his claim.
There's a reason for such epidemic rates of autism, and we're going to bring it back to much closer to where it was.
A lot of us are concerned about what is causing autism, and we need more studies on that. One thing we know is that it's not vaccines. Could be other things, environmental factors. We should be studying those things and not getting distracted by the vaccine part.
The medical director for the Cuyahoga County Board of Health, Dr. Prakash Ganesh, says the details of the new policy are still unclear, and he has not seen evidence that the current vaccine schedule is inadequate. He says he continues to follow the schedule in his practice. 1 dose of the MMR combined vaccine around 1 year of age and a second dose around the age of 4.
If that means using the existing vaccines that we are giving in the current pediatric vaccine schedule, is that the same doses being spread out longer, or is it going to be cutting out certain vaccines? Spreading out vaccines or splitting them apart is going to be added visits to the doctor's office, more than one might want to. But they were combined for a reason, and they've been successful for a long time, and have reduced barriers for patients to get in and get these vaccines.
Medical professionals say vaccines remain one of the most effective tools for preventing serious childhood illnesses, with their safety and effectiveness well established. Governor Mike DeWine issued an emergency order increasing state oversight of addiction recovery houses, putting them under the management of the Ohio Department of Behavioral Health. The governor says there are more than 1,700 recovery houses operating in Ohio, up from 356 in 2022. They're supposed to help people struggling with addiction as they go through court-mandated recovery. Under current state law, such houses can receive accreditation by one of 2 independent nonprofits. But Behavioral Health Director Tia Moretti says because of sometimes unsafe conditions, including overcrowding and the sudden rise in the number of recovery houses, the state needed to take control.
The Department of Behavioral Health has moved from overseeing recovery housing systems to directly managing it. We want every Ohioan who is seeking recovery housing to have the confidence that the recovery home they walk into is safe, well managed, and providing the supports they need to continue their recovery journey.
DeWine's emergency order is going to be in effect for 90 days, during which time Moretti says the department is going to coordinate with partners and stakeholders to file a permanent rule that will be up and running by the time DeWine leaves office at the end of the year. Stay with us as our analysts talk about whether we should get the flocks out of here and the power of special interests. Welcome back. We have on our roundtable with us this week Matt Dole, Republican strategist, and from the progressive side we have Maria Bruno back with us. One of the things we were talking about earlier in this program is special interests, a group very concerned about the nursing home industry, but we found out, the same person lobbied for labor groups and giving money to political organizations and candidates. Should we be worried about special interest money and its influence on our election process? Maria?
I think that no one really likes that our, airwaves get flooded with lots of outside money every single election season. I also don't think either party is going to fight with one hand behind their back. So I always am concerned about who's giving someone money. I assume people that are giving money because they think that candidate will help them. So if an industry is giving money, I mean, there's something to read into that probably. But this is how it is every year.
But I also believe that each side will say, well, your special interest is a problem. Mine are supporting me because I'm voting the right way. It's really hard to remove money from politics.
It is, and it's harder since Citizens United, obviously. I will say one group that does like this is TV stations. So good on them for bringing that outside money in.
Yeah, absolutely. It's really kind of disingenuous for me to sit in this studio and say, let's get rid of all this outside money. But does it affect votes? I mean, I think if someone, we heard about the insurance industry, we heard about labor unions. If they're giving you a lot of money, it's going to be difficult for when their issue comes before you to vote against them.
I think if a campaign relies specifically on donor money to continue to be competitive, I think you can reasonably be concerned about potential conflicts of interest. I think that's always the case. It's the same case when we are regulating industries that they also, hold stock in or have ownership in. So I think those conflicts of interest are always there.
And as a consultant, I'm going to step on my own foot now and say that I don't know that the amounts of money coming in are efficient. I think there's a law of diminishing returns. When you see 150 million on TV, people tend to tune out at some point.
Yeah, it gets to the point there's just an exhaustion from all of these ads. I also wanted to ask you something that came up not just locally, but really this is going on around the country. What to do about these flock cameras? We know some big cases were solved locally because of them. Police rely on them now, but they also can misuse them, right? What do you think?
Yeah, I think that civil liberties have to be protected. Flock cameras, I don't think, go so far as to invade someone's civil liberties. I think they can be useful getting license plate numbers and taking dangerous people off the streets. And if someone does abuse the system, as we've seen even here locally, they should be held accountable.
Yeah, and there's also concern about who has access to this data because a lot of people were concerned about ICE. A city like Columbus that doesn't want to cooperate with ICE might have also been sharing the information.
Yeah, and I think often you'll hear defenders of these cameras say, well, local control can regulate how they see fit, but the reality is these cameras are reaching hundreds of thousands of police officers around the country. We can't expect that everyone will have the same degree of, respect for our civil liberties. So I think it's really important that there are guardrails and that, we don't just fall into this trap where we're always being surveilled.
Yeah, it's hard to argue with them, though, when you have murder cases being solved that otherwise would not have been. Their need for these cameras. Well, when we come back, I want to ask you as well about a big change that came out of Washington concerning vaccines for your children. Welcome back. This week, President Trump signed an executive order basically trying to change the entire vaccine system. He used information that scientists and physicians and the AMA say is not accurate, tying vaccines to autism. Should we be concerned about these orders that are coming from people who are not scientists and are not doctors, including Robert Kennedy?
Absolutely. I think there's been bipartisan pushback. I mean, you saw Republican Senator Bill Cassidy immediately, who is himself a physician, call these out and say this is contrary to science. So I think it's terrible when we're making laws that don't line up with the information that we know to be true.
What do parents do? Parents don't know who to believe because it's become, instead of being medical, it's political.
That's absolutely right. It is political. And even Bill Cassidy, Donald Trump defeated him in a primary, so that's political as well. I think there's, I don't doubt that the people who signed this letter are scientists. I do doubt that they're doing it in their official capacity and not their political capacity. And I think that's the challenge for families. The good news is again, Trump isn't ending these vaccines. Trump is essentially saying, send the decision down to the states, send the decision down to individual families, and they're going to have to educate themselves and do the right thing.
Yeah, that's the problem. A lot of families just don't know. When you hear all of this varying information and this fear of autism, you feel for parents. They don't know what to do now. Well, thank both of you for being with us. Thank you for being with us this week, and we'll be back next week on Sunday Briefing.
Get some goggles and stand back, baby.
It's going to be so downright gorgeous.
Joining me now on For Your Weekend.
Sharing these stories will impact someone else.
Thanks for joining us tonight for News at 9. It's the only place that you can see a 9 p.m. newscast.
We are back. Welcome inside.
And I'm like, I've lost it all.
Well, that's the million-dollar question.
Let's take you up there on our map, show you exactly where this is.
I feel like we are now inviting people into our world.